Hey everyone, Shawnta Jackson here. Thank you so much for joining me today. We are streaming live on both Facebook and YouTube. My purpose in life is to help people to help themselves and others, and I do that by using this platform. I'm using this platform to bring on individuals who are thought-provoking, inspiring, empowering, and they are informative. Today, our topic is sexually transmitted diseases. And my guest is Dr. Christina Madison. I'll take the time to read her bio. So Dr. Christina Madison is founder and CEO of the Public Health Pharmacist, LLC, a public health consulting firm. She is a clinical pharmacist specializing in public health with a focus on infectious communicable diseases. Dr. Madison is currently an associate professor of pharmacy practice with Roseman University of Health Sciences College of Pharmacy. She is currently the director of Roseman University COVID-19 vaccine operations, logistics, and distribution, as well as the point of contact for the state of Nevada for COVID-19 or for COVID vaccines. She has personally facilitated the administration of over 5,000 doses of COVID-19 vaccine in her community in Southern Nevada since January 2021. She maintains 2 active clinical practices with Huntridge Family Clinic, which focuses on LGBT community and is one of the largest providers of HIV and gender-affirming care services in the state of Nevada, as well as Volunteers in Medicine of Southern Nevada, where she offers immunization and communicable diseases care, or communicable disease care, should I say. So again, everyone, welcome. Please do sign in. Please do ask your questions and your comments on the chat box. But before we get started, I want to maybe issue a few guidelines or agreements that we all can agree to. Because we are talking about sexually transmitted infections or sexually transmitted diseases, this is a sensitive topic. And we want to just be mindful of our comments and our language, because there is somebody who's watching that actually needs this information. And one thing that I don't want to be responsible for is shaming anyone. Okay, so just keep that in mind, that we all come from different places in life. We all have different life experiences, and this information that we're talking about today is informative, and it's to help us to make better decisions to take care of ourselves, our family, our children, and our community. And at this time, I will bring on Dr. Christina Madison.
Hi, Shawnta. Thank you so much again for having me.
Thank you so much for joining me, Dr. Christina. And where are you today?
Oh, so I'm actually at my office on campus because I'm still facilitating vaccination clinics. And so I actually was just down the hallway, making sure that they were all set up and ready to go for us to start accepting patients at 10 o'clock Pacific Standard Time. And then after this, I'll be going back and helping with vaccinations for the rest of the day. So.
Okay, well, thank you. I appreciate you taking the time to speak with me today, because I know how your schedule can get. And just checking in, we have GB. He says, "What's up?" He's watching from YouTube. Thank you. So before we start talking about sexually transmitted diseases, are there any updates that you would like to provide, especially to your local community in Southern Nevada, regarding the COVID-19 vaccines?
Yeah, absolutely. So the biggest thing I would say is that Nevada is actually going to be transitioning to allowing all individuals age 16 and up to be vaccinated starting April 5th. And so if you can start looking for appointments, if you want to get vaccinated that week, because we do want to try to get everyone immunized in our community as quickly as possible. Nevada, we started off a little bit slow, but now we're one of almost the top 10 states for vaccine distribution. So last time I checked, I think we were number 12th in the nation. So we are definitely doing what we can, because we want our hospitality industry to come back here. We want our tourists to feel comfortable. And the only way for us to do that is to get our community and our house in order first, for people to feel comfortable when they come to visit us here. So I think that's a huge milestone for us here in Nevada, that our governor took the steps to really accelerate being able to allow vaccination for all all adults and in this case, adolescents down to the age of 16 for the Pfizer vaccine to be able to get the vaccine starting April 5th. So just really big news. And then also that we are actively administering the Johnson & Johnson vaccine, which is just the one and done. So that means that people can get vaccinated and then they're fully immunized just 14 days later.
Okay. And what's the effectiveness, excuse me, on the Johnson & Johnson?
Yeah, so all three of the current vaccines that have EUA status or emergency use authorization are 100% effective at preventing hospitalization and death. So that's the statistic that I like to tell people, because I think there's been a lot of debate about, some of the differences in numbers. But honestly, if you think about what you're comparing, you're really comparing apples to oranges. So with the two messenger RNA vaccines, which is the Pfizer and Moderna products, neither one of them were studied in the presence of the current variants or the current viral mutations. The Johnson & Johnson product, however, was. And so we may not have had as high of an efficacy at that 94 or 95% if they had been tested in what we call real world situations, which is currently what we have right now. And we have both the UK and the South African variant that are actively circulating in the United States, and both of which the J&J vaccine has been tested against. And so I do like to just tell people that, the number one statistic that you should be concerned about is that it is 100% effective at preventing hospitalization and death. And that's really what has, unfortunately, disproportionately impacted, our vulnerable populations, our LGTBQ, brothers and sisters, our BIPOC population. That's what we're trying to get at. We're not just looking at getting the vaccine out quickly, but getting it out equitably.
Okay, thank you for that. And I just wanted to just have the opportunity, because I know you're working actively right now with the COVID-19 vaccines, and that's and with a lot of people, we had to make it the shift, and that's the priority. But thank you for that update. And let's get into it. Let's talk about sexually transmitted diseases. I was reading data from the CDC, the most recent data published from 2018.
Yep.
That's that in 2018, and even now they estimated that 1 in 5 people in the United States has a sexually transmitted infection at any given time. Mm-hmm. And young people between the ages of 15 and 24 account for nearly half of those new sexually transmitted infections. And then also women are disproportionately affected by sexually transmitted diseases as well. At this time, I would like to, I guess we can just start talking about what is the difference between the language. So there's sexually transmitted disease, and then there's sexually transmitted infection.
Yeah, so I think in general, we try to avoid using language that may be stigmatizing. And so when we say it's an infection, then that's not defining of the person, right? So the infection has a cure, we can manage it. It's all about knowing your status. And then making sure that you're managing yourself and your sex partners properly. When we say disease, that makes it seem more like, there's no cure, and, it's something that it's happened to you. And so I think, those terms tend to be used kind of interchangeably, but ultimately we try to use the term more STI versus STD because of some of the stigmatization associated with that. We also look at some language like if individuals are engaging in what we call transactional sex, right? And so again, using, terminology that's less stigmatizing because, depending on the individual, they may be engaging in those, those behaviors because of their own volition. It may not be because they're being trafficked. It may not be because they, are, exchanging, themselves for, sex or, or drugs. It may just be literally that is their means of employment, right? And so using terms like transactional sex versus things like prostitution or, if you have like a quote unquote pimp, right? Like we try to avoid using those kinds of terms because again, it really does stigmatize people and it makes them feel less accepted for their personal choices. And again, I always tell people, we need to get more comfortable talking about sexual health, and really talking more about sexual health, right? Because your sexual health and wellness is how we are able to get to the point where we feel more at ease talking about these things. Because part of the reason why we have such disproportionate numbers is because of lack of disclosure. And that lack of disclosure is often because of lack of confidence that they feel like their partner will accept whether or not they either want them to use a condom, or that they'll accept the fact that maybe they have multiple partners. And so again, having that open dialogue and that ability to talk about health and how do you have sex safely, and how do you enjoy sex, right? Not talking down to people, like that's usually the way that I ask the question. And again, I work in a population where, everyone in my practice gets asked about their sexual health. And I think that that should be incorporated into all primary care clinics. Obviously, my LGTBQ brothers and sisters are disproportionately impacted by sexually transmitted infections as well as HIV. And so again, we are having that conversation because we know that they have that health disparity, but ultimately everyone should be having this conversation. It should be about health and wellness and how do you enjoy sex, right? Because here's the thing, everyone has it. We just want you to have it safely.
Yes, and you actually said you dropped a few gems. So you said a lot. So let me go back. And so first I wanted to correct myself on air. And so the topic of the show was sexually transmitted diseases. And so I'm glad that you explained the difference. And for me, it wasn't necessarily, I wasn't thinking about this. I was thinking more like the clinical aspect of it. I was thinking more so, so the title for it was more so the state with the symptoms and the condition. And but thank you for that. And you are correct. So there we have it, everyone. Sexually transmitted infections. Okay, and so let's talk about the different sexually transmitted infections. Viruses versus bacteria. If maybe you tell us just really quick, what is the difference between virus and bacteria as it relates to sexually transmitted infections?
Yeah, so great question, by the way. So the first thing I would say is that if you're just looking at it from the standpoint of like the major difference, usually if you have a bacterial infection, that is typically something that I can treat and cure with an antibiotic. Versus a virus, depending on what that virus is, I may be able to treat your symptoms, I may be able to suppress your viral load, but I may not be able to cure you. So that's kind of the major difference. So if you think about most of our sexually transmitted infections that we are most concerned about, and the ones that we are deeming what we call communicable, meaning that it can be easily passed from person to person, typically from unprotected sex, those infections that are the bacterial ones are going to be things like chlamydia, gonorrhea, syphilis, right? And then for women in particular, things that put them at higher risk for HIV acquisition are going to be things like bacterial vaginosis, vulvovaginal candidiasis, or basically a yeast infection, and then something called Trichomoniasis, which is actually a protozoa, but we can cure it. So those are kind of the main bacterial sexually transmitted infections. And then on the viral side, we've got things like...
Really quick for the audience, really quick. Okay, so we have a lay audience. And so you mentioned... No, you're good. So, and that's why we're here talking together. And so you mentioned, so bacteria can be cured. And so there's chlamydia, gonorrhea, syphilis, and so bacteria, but
Trichomoniasis.
I want to say trick.
You can just call it trick.
Okay, yeah. So it's not a parasite.
It's a protozoa.
Okay, what's that?
So protozoas are it's not a parasite. So parasitic infections are usually ones that go into the host and manipulate the host. In this instance, it's a protozoa. So it's the way that it grows. It's a obligate. It's kind of its shape, and it kind of has teeth. If you're a Stephen King fan, if you've ever seen the movie The Langoliers, that's what a Trichomoniasis protozoa looks like.
Okay. And so but trick can be treated.
It can be
with
treated and cured. Mm-hmm.
Treated and cured. Okay, so gonorrhea. When I received my master's in public health when I was applying in 2009, my topic for consideration was on antibiotic resistance. And so that was the issue then. And so tell us a little bit about antibiotic resistance with the bacterial infections that you just mentioned.
Yeah, so the concept of antimicrobial resistance basically just means that if you have an infection and it's caused by a bacteria, and I use an antibiotic, depending on which antibiotic I use, I may have to use higher doses in order to cure you, or I may have to completely use a different antibiotic because the one that we were using, the bacteria has outsmarted it and has learned how to continue to grow and to multiply despite being in the presence of the antibiotic. And so that's really the concept of resistance. It just means that I give you the drug, but the drug doesn't work because the bacteria has outsmarted it. And usually the reasons why that happens is because ultimately we are using antibiotics for things that we shouldn't be, right? So the sort of inappropriate use of antibiotics for things like viral infections leads to overall antimicrobial resistance within a population. So if I'm using a bunch of amoxicillin or azithromycin, which are two very common antibiotics for like the common cold, which we know is viral and not bacterial, then there's this, underlying, exposure that the bacteria gets, right? So it's like, hey, I saw that before. I know what this does, and it outsmarts it. And so then when you actually need it, it's not effective. And so with gonorrhea in particular, we've actually had to recently update the STI guidelines. So the CDC actually came out with recommendations at the end of 2020 saying that higher doses of a type of antibiotic called a cephalosporin is necessary in order to treat and cure gonococcal infections because we've seen so much of this antibiotic resistance. So we know that, and unfortunately, there's very few things that we can use to treat gonorrhea. And so it's like limiting, we keep limiting the options that we have to cure this. And we've had superbugs where nothing cures them. So that's ultimately what we're trying to avoid.
Okay. And I think it's important to mention to the audience that with these sexually transmitted infections, half of them are young folks. And so young is of 15 and 24. So these are our children, our nieces, our nephews, our cousins, our students, our children's friends, right?
Well, not just that, but the fact that these infections, if left untreated, can cause long-term fertility problems, right? So chlamydia and gonorrhea both, if left untreated, can lead to infertility in the person that has the infection. So it's not just the fact that it's in young people, it's in young people who, they're living in a world where sexual health is not something that's discussed in a lot of detail because we are kind of in this post era of AIDS, right? Where people were so afraid, right, of catching HIV that they were like, wrap it up, right? There were all these campaigns. And then we got really good at treating HIV and then we stopped talking about sexual health. And it's like, we still need to talk about sexual health, even if we have things like PrEP and, HIV medications. And so I think that's the disconnect, right? We have a whole generation of people who don't know what it's like to lose somebody to AIDS. right? So that fear factor that was motivating people to practice safe sex is no longer there, as well as the fact that sexual education for a lot of schools is no longer a priority, right? If you think about things that get cut when budgets get cut, and we know this because we've been working in public health for, over a decade and a half, that when public health is not prioritized, these are the things that happen, right? When you stop doing these kind of community outreaches, when you stop talking about teen pregnancy prevention, when you stop talking to people where they are and where they live, and you start, putting up barriers, right? So one of the things that drives me crazy is that a lot of my local pharmacies, because they're worried about loss prevention, lock up the condoms. And I'm like, so do the condoms need more protecting than the people? And if that's the case, why are you not providing them with an alternative to where they can get condoms for free?
Exactly. And before we continue, so we talked a little bit about bacteria,
viruses,
and infections. So I want to go back to viruses, but before we do that, I want to check in on the chat box and say hello to everyone. So again, we have GB watching from Las Vegas, and we have Kevin Lang in Las Vegas. He says, good morning. We have Pierce in Texas, in Dallas, Texas.
Nice.
We have Falcon Stir Alley. He is checking in from Uganda. Thank you, East Africa.
Whoa, amazing.
Yes. And we have my mother checking in. She says, good morning, and thanks for the explanation of the Johnson & Johnson vaccine. And have a great day to you.
Anytime, Belinda.
Yes.
You call me, honey.
She will.
I know.
And we have Rico checking in. Rico is in Baltimore. Correct me if I'm wrong. I think he's in Baltimore. He says, good morning, everyone. Peace and blessings. And Kevin says that you make him want to have an examination before having sex. And I don't think that's a bad idea.
Yeah.
I mean, when we go to our physicals, why not have a full panel? I do.
We used to say this all the time at the health department. You and your partner coming down to my sexually transmitted infection clinic is the best first date you could ever have, because you both come in, you both get yourselves checked out, and then everybody knows their status. So there is absolutely nothing wrong with that. Not to mention the fact that asking your partner when the last time they were tested, there should be no stigmatization on that, right? If anything, that would make me feel great, right? If somebody asked me, hey, I'm starting to, get to know you a little bit better, and I'm digging your vibe, and if we're going to take this to the next level, I would need to know, when was the last time you were tested for a sexually transmitted infection, because ultimately I want to know that whatever we choose to do is consensual, obviously, but also that we do it safely. And I think that is an amazing conversation to have. And I will tell you, more chances than not, the appreciation for your overall health and wellness, right? Because again, your sexual health is related to your overall health and wellness, right? The fact that we separate it from your general health, I think also adds to the fact that it's stigmatized, right? It's not, because here's the thing. It's almost as much of a problem if you're having a lot of sex with a lot of different people as much as it is if you're not having it at all. So what's going on that you're not engaging in those relationships? Because those are healthy relationships. If you're not having, sexual encounters, why is that? What's going on? Is there some underlying mental health issues there? Are there some health concerns that you have, related to your genitalia, and that's why you're not engaging in encounters? Like, let's check that out. Let's figure that out, because it's healthy to have regular encounters, right? Ultimately, we want you to have those safely, but it's just as big of a deal if you're having too much, if it is that you're having too little, right? So you got to ask all of those questions, right? And again, asking it in the affirmative and the positivity, and meeting people where they are, right? So not asking them as if it's this clinical diagnosis, but saying, hey, how do you enjoy sex? Who are your partners, right? How often are you having new partners, right? How many partners have you had in the last 90 days? Are you consistently using condoms? If not, can we talk about your prevention strategies like PrEP? And if you are choosing not to use condoms, that means you really should be testing more frequently, right? So here's these things, like, it's not a hard stop, right? If somebody tells you, sorry, I just don't do condoms, you shouldn't look at them and say, well, sorry for you, I can't help you. No, you come up with a strategy that works for their needs. And again, you need to meet people where they are.
Yes, and so it is important to have those conversations. So that's why it's important for us to slow down, get to know the person, allow the person to get comfortable enough with you so that they can have those conversations. Some people, it's actually a turnoff. For me, it's a turnoff when I receive sexual advances from men early on. And you never ask me, so you just, I guess because I'm smart and I guess I look clean. Like everyone who's going to have sex with Medusa, who they feel is Medusa or something, So it's
that concept of clean versus dirty, like that language is really stigmatizing. So again, like we try really hard not to utilize that kind of term. And again, it's not about clean or dirty, it's about safe, right? It's are you using condoms? If you're not using condoms, what are your prevention strategies, right? How are you enjoying sex safely? Right?
Safer. Yeah.
Safer. Yeah.
No. So when I was saying the clean, I'm just saying that these are what people are thinking.
Oh.
I've definitely, yes. So clean, dirty, monster. I actually get upset when I see some blogs, especially Black blogs or African American blogs, when they refer to HIV as the monster, and people are repeating that, and I'm like, no wonder no one wants to talk about it. No wonder people don't want to get tested and don't want to know, because if that's how you're referring to people, but it's not helping us. It's not helping, not helping. So you mentioned PrEP. So everyone, we had Dr. Cassandra on, and I interviewed her. She's an HIV pharmacist as well, and we did an episode on HIV, and she talked about PrEP. So please do go back and watch that episode. Okay, so viruses. Let's get to viruses. So what are the sexually transmitted infections that are viruses, the most common?
Yeah, absolutely. So biggest one that you guys should know about and that are vaccine preventable, ding, 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 right? So you can get a vaccine to prevent these are HPV, hepatitis B, hepatitis A, and then we have HSV, and then obviously HIV. So the three that are vaccine preventable are the two types of hepatitis, so Hep A and Hep B, which can be sexually transmitted, and then HPV, which is also sexually transmitted. And then ones that don't have a vaccine are going to be HSV and HIV. And then also Hep C. Hep C does not have a vaccine as well, and is also could be sexually transmitted.
Okay, so HPV, human papilloma virus, correct?
Human papilloma virus, yes.
Papilloma, okay, human papilloma virus, HPV. And HPV is also known, so let's talk about some of the related conditions to HPV. So from my understanding and the things that I've read over the years is that a lot of us, so there's multiple strands of HPV, and a lot of us have had probably come in contact with one of those strands, but our body can, because of our immune system, we can be infected with something or a virus or come in contact with the virus and our bodies can shed it. I'll just say that. So we can shed the virus and we would not have even known that we've come in contact with it. And if we were tested, then it wouldn't even show because our body shed the virus. But there are certain strands of HPV that can cause cancer. Can you talk to us about those cancers?
Yes. So there's over 100 types of HPV that have been identified. And of those, there are what we call oncogenic types, which are the cancer-causing ones. And then there are genital warts-causing kinds. So 6 and 11 are the genital wart-causing kinds. And then 16, 18, and 11 are the ones that we typically associate with oncogenic types, or the cancer causing types. And so of those cancers, obviously the one that you hear about the most is cervical cancer, but it can also cause vulvovaginal cancer, penile cancer, and anal cancer. And then HPV is actually responsible for about 80% of all head and neck cancers as well. So something that a lot of people I don't think realize, and as we see more people engaging in oral sex, and things like rimming, we're seeing more of these issues, and needing things like endoscopies as well as pap smears, right? So when you get tested for cervical cancer, when you go to your OBGYN, they typically will do a swab, and then that information is then taken, and then it's done under what's called cervical cytology. So it looks at the cells to see if they're abnormal or not. And then it's also sent off for HPV typing. And that HPV typing will tell us if you are positive for an oncogenic type, or just one of the types that's less likely to cause disease or illness. And so with the fact that we're seeing higher rates of anal cancer being associated with HPV, we're now recommending for all of our MSM population to also get what's called an endoscopy. Men who have sex with men.
Okay.
So our men who have sex with men population, or actually anybody who's regularly engaging in rectal sex, should be considering getting an endoscopy. And so basically it's a similar concept. So we're just testing for abnormal cells, and then we're also testing for those HPV types to see if they're the ones that cause cancer. I will tell you, since we have implemented vaccination, we have seen a drastic decline in our cervical cancer rates, but we're still seeing things like head and neck cancers, and things like anal cancer as well, and penile cancer.
And even in the throat, so the back of the...
Yeah, so that's part of it. So it's all about 80% of all head and neck cancers, which includes, the esophagus, the tongue, inside the mouth. Yeah.
Okay. And just as a reminder to all of my guests in the chat box, when I first started, I explained that we all have different life experiences, and we all come from different backgrounds and have level of understanding and experience. And the fact that we do not want to, so I corrected myself. I named the show, I entitled the show Sexually Transmitted Diseases when it should have been infection. So we're talking about sexually transmitted infections. I made a comment about how guys will say something like, "Oh, you look clean." And then Christina quickly jumped in and corrected me, or just really just jumped in, not necessarily to correct, but to educate me and you all of being careful not to stigmatize. And so just be mindful in the comments in the chat box of some of the things that you say, because there's someone who is watching or who is listening that really needs this information, and who may need to have a conversation with someone, or who may need to feel like, you know what, I think it's important for me to go get tested. So we don't want to deter them, right? And so just keep that in mind. And so we talked about HPV, and HPV, there is a vaccine for HPV.
Correct.
Are you eligible for that vaccine?
So anyone between the ages of 9 to 45, actually. So they expanded the indication from 27 to 45-year-olds in 2018. And then the ACIP, which is the Advisory Committee on Immunization Practices, incorporated it into the 2020 vaccine schedule. So now you can go in and get vaccinated all the way up to the age of 45. And I think some people are like, well, do I still need to get vaccinated even if I've had an abnormal pap, or even if I've, had abnormal cells? And the answer to that question is yes, because there's so many different strains, and in the vaccine, there's 9 different strains that it protects against. So it's always a good idea to get vaccinated. Vaccination is more protective. And then, again, just kind of going back to the differences between viruses and bacteria in this instance. So this particular virus, if it is not cleared by your immune system, okay, because it usually can be cleared by the immune system within 1 to 2 days, or 1 to 2 years of the initial exposure, is a non-curable virus, right? So there's no cure for HPV, right? So it's whether or not it's, it can develop into a cancer or whether that may develop into genital warts. And those genital warts can present at any time. And so, so those kinds of things, I always like to tell my clients, if they come in and we talk to them about, sort of what their overall risk is, you want to be able to distinguish between things that have a cure versus things that do not have a cure. Right. And so we want you to protect yourselves from all things. Right. So just being on something like PrEP does not protect you against sexually transmitted infections. So you may be preventing one thing, but not looking at the whole picture, right? And so having an untreated STI puts you more likely to get and give another STI, right? So you're 2 to 5 times more likely to get or give one if you currently have one that's untreated. So I tell my students all the time, a sore is a door, right? So if you have something going on, like you're more likely to pick something else up, right? Doors open. Come on in, people. Right? So yeah, yet another reason to get regular screenings and testing.
Yes, and so before we move on from HPV, you mentioned the vaccination age is between 9 and 45. And for the parents out there, it's important, in my opinion, for you to vaccinate your children before sex, and them having the HPV vaccine is the best way to prevent to help to protect them for when they do decide to become sexually active older in life.
Well, not just that, but remember, HPV can be spread just from skin to skin contact. So I try to avoid associating it with sex because I think that's how we got off kilter with the messaging. I think that's why we still have so much vaccine hesitancy as it relates to the HPV vaccine, and really talking about it for what it is. It's an anti-cancer vaccine. So you wouldn't tell somebody not to get the hepatitis B vaccine, which we also consider to be a anti-cancer vaccine because it prevents against hepatocellular carcinoma, but can also be sexually transmitted. But the messaging behind that was different, right? We give it at the time of birth, right? So that baby's protected so they won't get cancer, right? That's not the way we were phrasing this for HPV, right? So because of that association with sex, automatically the parents are like, well, if I give them this vaccine, I'm somehow going to be giving my children a license to have sex. Well, you don't even have to have sex to get this. You can just have skin to skin contact. That's it. That's all you need. Just makes the leap.
I learned something new. I didn't know that. I didn't know. So at the time, so everyone, my background, I was a sexual health educator. I worked I delivered evidence-based and curriculum in Las Vegas, working for Planned Parenthood and Southern Nevada Health District, working with youth in various settings. And so at the time, you kind of go off of the medically accurate training that you're given. So that was something new that I learned today. And we do have a comment. GB says this convo benefits in many ways, and besides the obvious exchange of clinical definition, but also learning about the innocent terminology, about how innocent terminology can stigmatize.
Absolutely. It's all about how you word things. And like I said, even just the association with that vaccine with preventing, HPV transmission through sex, like it really hampered our vaccine efforts because so many people, had that negative connotation associated around it. And so they were much less likely to vaccinate their children because the recommended age range is 11 and 12. And so that thought process that I'm preventing them from getting something that's sexually transmitted at 11 and 12 is like, oh my gosh, why would I do that? Because my 11 and 12-year-old aren't having sex. So why would I do that? But what they're not realizing is that vaccine works best when I vaccinate you prior to an exposure. Right, which is actually the thought process behind all vaccines, right, is that they have the most benefit when I vaccinate you prior to you being exposed to that wild type infection. And so it's like that for HPV. It's just the thought process of somebody thinking about their 11 or 12-year-old having sex just is so negative to them that they're like, yeah, I'm not getting that. And so, the schools tried to mandate it, that backfired. I just tell parents, these are all the recommended vaccinations, right? It's the adolescent trifecta. And I try to go through it really fast. I'm like Tdap, meningococcal, and HPV. Like I kind of say it, so it's like, these are all the recommended ones. this is going to help protect your child. Oh, you don't want to get it today? Okay, that's fine. I just want you to know if you want to come back, that's not a problem. Here's some information. You can read it. Obviously, I want to make sure that I am acknowledging that you have hesitation, and I want to make sure that I'm answering all your questions so that you feel comfortable providing this vaccine to your child. And again, we don't want to leave your child unprotected. We want to have them protected prior to this being a concern.
Okay. And so there's HPV, non-curable, HIV, non-curable, and
also preventable.
But they're all preventable.
Yes. Well, with like active vaccination or medication was what I was medically preventable was what I was getting at versus just, having safe sex.
So you mentioned, so we have HPV. I just wanted to clarify that for the audience. And then HIV, HSV. So HSV is herpes simplex virus. So there's HSV1 and HSV2.
Yes.
Could you tell us, whatever information that you can give us from your professional standpoint on HSV, herpes simplex virus?
Yeah, so HSV is pretty ubiquitous, meaning there's a lot of people who have it in various forms. So HSV1, think one, oral labial, HSV2, right, between your legs, got two legs, right? So HSV1, HSV2, yeah, right? The other thing too is that the term oral labial, right? So labial means lips. Technically, you've got two sets, 1, 2. So you can get both HSV1 here and HSV1 down there. HSV2, which is genital, you can only get it in the genitals. So hopefully that cleared it up. HSV is also non-curable, but we can treat you episodically. So once you have an active outbreak, then we treat you. If I test you and you come back positive for HSV antibodies, doesn't really do anything because I'm only going to treat you unless you have symptoms. So typically I recommend against screening for HSV unless somebody has an active outbreak. Because again, that's really what I'm concerned about with their infection risk, because then they could spread it to others. Because when you have that active lesions, which by the way are usually multiple and they're painful and they produce a lot of what we call exudate, so fluid comes from the lesion. That fluid is extremely infectious, so much so that like somebody could infect another part of their body just by wiping themselves when they went to the bathroom. So just being very careful to wash your hands thoroughly, making sure that you have the treatment available. And so it's an antiviral medication. So it's either acyclovir, valacyclovir, or famciclovir. So they all say cyclovir, so you'll know that. And it's depending on whether or not it's the first time you've had the infection versus if it's another outbreak, you would be treated between 7 to 10 days or 5 days. And then if you're somebody who has really frequent outbreaks, which is something that can happen if you have more than 6 outbreaks in a year, then we recommend something called suppressive therapy, which is where you take a daily medication to suppress the virus so that you don't have continued outbreaks. And it also helps with transmission as well. So it decreases your risk for transmission. It doesn't completely eliminate it, but it does decrease your risk for giving it to someone else.
Okay. And a pregnant woman.
Yes. So pregnant women are all screened for a variety of sexually transmitted infections because, again, some of these infections can be very detrimental to the health of the fetus and the unborn child. And so we definitely want to make sure that we're doing appropriate screening. For HSV in particular, it's important that your healthcare provider know that because most of the time they will opt to put them on suppressive therapy, which is safe during the pregnancy so that they don't have an active outbreak at the time of delivery, because that's when it becomes an issue. Because if you were to have a vaginal birth, if you have an active outbreak, you could pass this infection on to your child. So again, we do visual inspection, make sure there's no active outbreak. These are all conversations that most individuals that have HSV will have with their provider at the time of delivery and or prior to that. And so, it's one of those things where, the longer you have it, the less frequently you'll have the outbreaks and the less severe they are. And so there's people who've lived with this for many, 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 many years and don't take anything and don't have outbreaks. If they do feel like they have, what's called a prodromal symptom, so they feel like tingly down there, they might have some soreness in their legs or their back. That means that they may be starting to get an outbreak. If that happens, they can take the antiviral medication and they can either completely stop the outbreak or really diminish how long they have symptoms. We're talking something that could last for up to a couple of weeks that maybe you have symptoms for like maybe a few days. So, having that conversation and making sure that you're honest and open with your healthcare professional, but also honest and open with your sexual partner, right? Because obviously you want to make sure your sexual partner is aware, because they may be, there is the potential that you could spread it to them and then they could spread it to someone else. And so, because this is something that is easily transmittable. And so it's just, being honest, being open, yet another reason why it's important to use, condoms correctly and consistently, but having that open dialogue with your partner, because then they can make the decision, yes, I love this person, I love the person, right? And this is something that happened to them and it's something that we can deal with. We're talking like 1 in 9 men and like 1 in 7 women. I mean, it's a lot of people who have some type of HSV. And in men in particular, they usually have what's called subclinical disease, which means that they have it, but it's so, like the symptoms are so small that they don't even realize that they have it, which is probably why they were passing it to their partner, because they never got checked, right? And it's usually like right around the base of the penis, or around the scrotum, right? And they don't even realize they have it. So yet another reason why you should turn the lights on and check your partner out.
Okay, and we're getting close on time. You have to go. So hepatitis, just really quick.
Yeah.
A and B. There are vaccines available for hepatitis A and B. Is this something kind of like HSV where your body can shed it? Possibly, or
so Hep A, there's no cure, but once you've had it, you're immune for life. So, once you get it and you've gone through it, you only get it as an acute infection. It doesn't go on to be a chronic infection. Hepatitis B, however, can develop and go on to be a chronic infection. I will tell you, if you are exposed as an adult, your likelihood of going on to chronic disease is much less than if you're exposed at the time of delivery. So if you are somebody who got it from what we call perinatal transmission, or vertical transmission from mother to child, you have about a 90% chance of developing chronic infection, versus if you are an adult, it's about a 5 to 10% chance that you'll go on to develop chronic infection. So most people have very mild disease, and you just have the acute infection and you never develop chronic symptoms. But for those who do go on to develop chronic symptoms, they can develop things like fibrosis, cirrhosis, and may even need liver transplantation or could potentially develop cancer.
Thank you for that. And I think that's it. So I think everyone, we understand there's viruses and bacteria. Bacteria are usually treatable with antibiotics, unless you have some type of superbug or gonorrhea. You may need a little bit more. You might need a little bit more medication. Our viruses, while we can treat our viruses, there are no cure for the viruses. But however, with HPV, there is a possibility that your body can shed the virus. And
you can clear the infection. Mm-hmm.
And then even with hepatitis A, and hepatitis A, even though it's considered a sexually transmitted infection, hepatitis A is also foodborne or waterborne illness. So that's why at the health department, you are required to have your hepatitis, is it testing? Yeah, you do the testing there because.
So they were doing vaccination, but then they revamped the health card area. And so they actually don't require that anymore, but that's because all children need to get Hep A vaccine. So they don't really need it anymore, because now most of the people that are part of that workforce have already been vaccinated.
Okay.
So, yeah.
Thank you for that. And just before we leave, just a few quick points that I wanted to bring up. So it's estimated that sexually transmitted infections cost us U.S. citizens $16 billion in healthcare costs annually, and the majority of those costs, $13.7 billion, are attributed to sexually acquired HIV infections, and $755 million were attributed to HPV infections. And so for the non-HIV related STI medical costs, 75% of those costs were among women. And so if we can just close out, and then if you can maybe talk about, how is it or why women are impacted differently than men, and what we can do to protect ourselves or to help ourselves.
Yeah, so the first thing I would say is that women by far are more likely to be routinely tested for sexually transmitted infections, either through their OBGYN or through the fact that we typically will recognize symptoms faster and are more likely to seek medical attention more than men are, right? So that's across the board. So a lot of these statistics, I like to say, are like a little bit skewed, because if you are routinely checking for something in a population, you're going to find it in that population. If you're not routinely checking for it in another population, your numbers are not going to be accurate. And so because we don't regularly and routinely check men for these infections, most of the time it is disproportionately looking like it's impacting more women than men. But who are the vectors? Who's giving these women the infection? It's the men. So I think that the cost side is really more related to things like infertility, right? So we have a whole generation of women that have struggled with issues related to infertility, most likely because of multiple factors. One is because of potentially inappropriate pap smear testing, and because the immature cervix can mimic abnormal cells. And so it was leading to inappropriate testing that could lead scarring in the cervix and then lead to infertility. But then also, these sexually transmitted infections can cause scarring in places like the fallopian tubes, and that chronic inflammation in that area can lead to issues with fertility. And so that those structural abnormalities that occur because the infection has actually altered the reproductive organs can cost money, because now these women are having to seek reproductive health services and infertility services when they wouldn't ordinarily, right? Or if they were admitted to the hospital for things like pelvic inflammatory disease, these are all things that may come up. Or during, a pregnancy, now they find out that they had an infection they didn't even know they had, right? And there's all these, these steps and things that they have to go through in order to make sure that they cure that infection so that they don't pass it on to their baby. So, we test for it, we screen for it. That's part of the reason why it's more impactful in women, but also just the fact that our anatomy is different and we are more susceptible to infection because of just the sheer size and surface area of our genitalia, and because it's internal versus external. So that is it.
Thank you, everyone. Thank you, Dr. Christina Madison, the public health pharmacist. Please do follow Christina on Instagram at the public health pharmacist. Again, Instagram at the public health pharmacist. And we have a final comment. We have a final comment from Falconster Ali. Again, he's joining us from Uganda. And he says, I love the way how Dr. Christina explains each and every point. She explains for someone to understand. God bless you all. And thank you so much for your comment. Everyone, thank you for tuning in. As always, my purpose in life is to help people to help themselves and others. And you can learn more about me at ShawntaJackson.com. Go on my website and subscribe to my mailing list, and then also like and subscribe to my YouTube page. And Dr. Christina, you have a podcast. Tell us a little bit about that before we sign off.
Yeah, so I actually joined the Pharmacy Podcast Network this year. And so my podcast, which is also named the Public Health Pharmacist Podcast, we just did our inaugural episode this month. And it's pretty much all things related to public health, health disparities, how we help vulnerable populations, why public health matters, why we need to invest in it, and why we need to invest in preventative care services versus chronic disease management. So, public health works best. when you don't hear about us, right? And so unfortunately, we're seeing the aftermath of when we don't invest in public health, which is why we've had so many challenges with this pandemic. So, regular routine contact investigations, mitigation measures, all of these things that we used to do and had the workforce to do it prior to the pandemic, and a lot of those people weren't hired, a lot of those investments weren't made, and even with the vaccine rollout and distribution, we're seeing those areas where they did not invest in that public health infrastructure really causing delays. And so we got to invest in public health, and we got to all do our part to protect those around us, because it's all about the health of the many, not the health of the one.
Yes, thank you. And thank you everyone for tuning in. Have a great rest of your day, and please wear your masks.